Okay, I see a few head nods. Well, again, thank you so
Yes.
much. I'm really pleased to be here on behalf of the Coalition for Trust in Health and Science. And as you noted, Zach, we are so pleased to have APS as a member of the coalition. We were founded back in March of 2023, largely based on two factors. One was the increase in and proliferation of mis and disinformation coming out of COVID, as well as a decrease in trust of both health and science. So as we move through, I'll talk a little bit about the coalition, how we came together, who's at the table, and do a deeper dive into some of the recent work that we've been doing to build trust in the context of health and science. So in terms of our core work and our mission, we are working together to ensure that all people have access to make informed and, very importantly, personally appropriate health decisions for themselves, their families, and communities. We want to ensure that people have access to accurate information that's understandable and evidence-based. I highlighted here on the screen, or I guess you could say I bolded personally appropriate, because that's a really important aspect of our work. By no means will you see our coalition coming out with declarative statements around take this vaccine, don't engage in that behavior. But we're really trying to ensure that people have access to personally appropriate information to make their own decisions. And we're doing this through a big tent model. We have a number of members spanning the entire health and science ecosystem. We'll do a deep dive on the next slide in terms of what our coalition looks like. But it's important to note that as we move forward together, we are focused on being collaborative, ensuring that we are a continuous learning network, and that we are pushing out evidence-based resources. So in terms of, my screen won't move. There we go. Our big tent. We are, for the first time, bringing together the entire health and science ecosystem. Here on the slide, we did not put every single organization's name, but we do literally run the entire ecosystem from science and research through various healthcare providers, provider sites of care, systems, insurers, payers, foundations, ethics institutes, as well as rounding out with both patient and consumer organizations at the table as well. And uniquely, all of these entities, these 90 plus members, have raised their hand to say that together we want to do better. And what that looks like as it manifests through our work is a pledge that all of our members have made, a commitment to both each other as well as the coalition to do three core things: to work to share our vision and our commitment with both the public, each other, as well as other stakeholders. We're working to support efforts to advance people's scientific and health literacy, as well as to earn trust from the public and promote health outcomes and health equity. And finally, to work both individually and collectively to correct misinformation and counter disinformation that could ultimately harm individuals and the public's health. So as we work to actualize our mission into our actions, we're really working at two core levels. So one is through our members at the organization or system level. So working with members like APS to promote and increase trustworthiness across health and science. We are definitely aware of the fact that for the vast majority of our member organizations, they are working with constituents within their membership who touch tens of thousands of patients and consumers on a daily basis. So we here at the coalition have a really unique opportunity to ensure that health professionals are getting accurate information, are getting tools for how to appropriately engage with patients and build trustworthiness in real time. Second layer of our work is to work at the individual or population level. So this looks like our continual work to both educate and to empower patients and individuals to help them create and access information that is both evidence-based and accurate so that they can make personally appropriate health decisions. I will walk throughout our conversation today, some of the actions we're taking on both of these two fronts. So we felt very strongly that as an organization, we couldn't just say, trust us and trust our members and call it a day. And so from the beginning of our organization's work, one of our board members, Dr. Mary Naylor from Penn Nursing's New Cortland Center, pulled together a subset of individuals within her team to help us dig into what does the evidence actually show us? What are the best ways of both building trust and addressing misinformation? And so, under Dr. Mary Naylor's leadership, we have been engaged in the Building Trust Initiative. Part of that work included not just the scholars that she brought to the table from Penn Nursing, but an ability to pull together a subgroup, which we've called the Building Trust Initiative, of scholars across various disciplines and various organizations to essentially kick the tires on the work that the Penn Nursing team has discovered. So looking at that a little bit deeper, we've divided this work sort of into three core categories. So we have the Penn Nursing team who took about 1 year to do a rigorous review of existing evidence, best practices. They took that information and brought it to the Building Trust Scholars Initiative. From there, over the course of about 3 months, those diverse scholars gave their opinion about the findings out of the Penn Nursing team, and they came to a ultimate consensus around recommendations for how to best move forward with the learnings coming out of the Penn team. From there, the scholars are recommending a large-scale application of the interventions around building trust and misinformation and addressing misinformation. They've also identified critical research gaps and a number of cross-cutting issues that need further exploration. I'll go into a little bit more detail now. So in terms of the Building Trust Initiative, of the various interventions that they found to have been effective in terms of peer-reviewed literature and various piloted projects around the country, they can say with pretty clear evidence to support it that there are a number of interventions that are promising and do work. These interventions include things like debunking. Here on the screen, we have a example from one of our materials that we produced, one-page summaries of these examples of how to effectively address misinformation and build trust. We also know that interventions such as accuracy prompting, the importance of health literacy and media literacy are also critical ways to help individuals gain access to good information and to build trust. Interestingly, part of the work that is still ongoing is the identification of a number of areas where we know that there are interventions that will likely work in turning around the tide on misinformation and distrust, but they do warrant further testing. So these are things like using social norm nudges or crowdsourced fact checking. The role of trusted messengers is another element that is still yet to be officially proven as an effective way to combat misinformation, as well as emotion-based approaches. So I'll pause here and say that this last bullet and the sub-bullet here are, again, as noted, promising interventions that still need to be tested. And we are very eager to work with member organizations like APS and others across the membership to pressure test and further figure out if these promising interventions can be successful out in the field. So this is an opportunity for all of our members to partner with us in pilot projects. So finally, wrapping up what we've learned coming out of our Building Trust initiative, there are a number of cross-cutting issues that even in the context of the well-known best practices that we know about and those that still need to be further explored, we have a number of outstanding issues that are very much on the minds of scholars and individuals, as well as our members as we work to rebuild trust and address misinformation. Those things include how do the interventions that were explored on the last slide, how did those play out in various communities across the country? And how does intersectionality influence an ability of those interventions to be successful? Definitions are really important. One of the tools that we've produced is what we hope is a comprehensive glossary of terms, so that as we as a field work to rebuild trust, be trustworthy, address misinformation, that we're all using similar definitions so that we can look at and measure outcomes together. Of course, exploring how human behaviors related to both trust and trustworthiness play out by various regions, cultures, and other lived experiences. Some of the other interventions here, or elements of cross-cutting elements that we're still trying to think through, include taking advantage of natural experiments. Can we do something in real time, especially as a pilot with one of our members, around social media and any interventions there? And the final bullet point here is, I think, a very important one. As we worked to work through the Building Trust Initiative and over the last almost 2 years of our organization's existence, we've really started to grapple with the wording of both trust and trustworthiness, and very much now leaning into how do we, as a 90-member organization, drive and be trustworthy, and not just trust us for the sake of trusting us. So moving into some of our other initiatives, communications, as you can imagine, is a very significant part of the work that we do. We have pulled together the communication staff of our member organizations, including some of the APS team members on with us today, as well as convened an external expert panel of communication experts across public health and science. Some of the organizations that are pulled into that external initiative are referenced here on the slide. Individuals, including journalists from KFF, RTI International. You may be familiar with Your Local Epidemiologist, a great effort led by Caitlin Gentilina, who's been participating with us, and some others. So from the work that has come together from that external communications advisory panel, we worked on and produced a resource for our members around messaging for trust. Here on the screen is an example of the distilled guidelines into a messaging card for providers out in the field. This is the first of many of the initiatives that we are undertaking, both with our internal member communications work group, as well as in tapping the experts within this panel. And as we move into 2025 and thinking about our communications work, one of the things that we are focusing in on is how do we take very high-level guidance, like this messaging for trust tool, and start to vet it with various patient and provider populations and tailor it to various either clinical settings, patient outcomes, or various patient groups. So working on education, as I noted earlier, one of the core pillars of our work is to help people make healthy, informed decisions. And so we have worked to directly engage with both patients and consumers. We've done this a few ways. We're really pleased with the partnership that we conducted earlier this year with the National Consumers League that resulted in a toolkit at a very high level, helping individuals understand the importance of making informed decisions based on evidence, educating around what is misinformation, what does it look like, how do you identify it, and a few different modules around important elements of health literacy, including what is risk benefit in the context of health? Why is evidence-based information important? We also did a national town hall, a virtual event to talk about the elements of that toolkit with several individuals from our membership and other experts. The last I looked, that had 1,390 views, which is very exciting. So the data is showing that we are getting out into the world of consumers and patients. Final thing I will say is I'm very pleased that we were able to update our website, well, frankly, revamped our website to create a better user experience for individuals. So as an example, we have retooled our resources to better organize them to help people understand the importance of finding accurate health information, understanding misinformation, understanding how basic science plays into health-related decisions. And as a plug to those on the line today, would be more than happy to evaluate resources that you have individually that might be helpful for this particular audience. And our continued learning elements, as Zach noted earlier today, we did conduct one of our biweekly Learning Lunch series productions. We had an expert from the University of Louisiana on talking about the disinformation framework that a robust team at the university has been studying for a number of years now. During this lunch series, we have featured great speakers, including APS. We've had individuals from the Washington Post, from Grapevine Health, from Gallup. We are already planning for 2025 programming. But the takeaway from our Learning Lunch series, which is a member-only exclusive benefit, is that we are bringing to the table, to our members, examples of both underscoring the issues at hand, like our conversation today about the scope of disinformation, as well as a deep understanding of the successful pilot projects that are taking place around the country. We are in a really great position, given our 90+ members, as well as external partners, to be able to not just showcase the islands of excellence and work that's taking place to build trust and combat misinformation, but also to take advantage of scaling, replicating, and advancing, amplifying these examples across our membership. So looking forward, as you may imagine, 2025 is going to be a very unique year for the health and science field, most notably given changes at the federal policy level. So as we plan for the coming year, I am definitely focused on all things training. The vast majority of our members are very eager to take those learnings and those islands of excellence, as noted on the previous slide and discussed during our Learning Lunch series, and create various training modules, videos, and other resources that span the entire workforce pipeline. As an example, we have a number of academic institutions within our membership. They are concerned about the early stages of the health and science pipeline. How do we get individuals excited in STEM, especially going into a field where trust is declining? We have individuals across our membership who represent professionals of various stripes across the workforce on all aspects of the pipeline, including those in the workforce now and even in the later stages of their careers who need and want resources. So very excited to be working on some dedicated training for professionals. We will also be expanding our work in terms of our direct-to-consumer and patient education. In particular, we are focusing on trying to help individuals better understand why evidence-based information is so critical as they navigate their health information journey and make personally appropriate health decisions. Another example of work that I'm very excited about is within our membership, we have 2 bioethics organizations who have volunteered to come together and to look at what are the ethical considerations related to life in modern America, especially in a pluralistic society. And how does that framework or lens of looking at life in America overlap with the delivery of public health, with the understanding of science. And so I do expect within the first few months of the new year to have a framework, if not an early publication from these organizations looking at these considerations, and we'll work throughout the course of the year with our members to figure out how do those ethical considerations actually play out in the field on a daily basis. And the final thing I'll say in terms of the context of the work that we have ahead of us is listening. Listening to our members, recognizing that each of our members are going into 2025 with a series of their own individual unique concerns as they relate to trust building and misinformation that shapes their work and that of their constituents. Also listening to communities and patients. If anything, especially coming out of the 2024 presidential campaign, it is very much on the minds of the leaders of our coalition and the leaders of our membership, recognizing that we have listening to do. It's an important element of the work that needs to be done, especially as we continue to see decreases in trust, as well as skepticism and disdain for elites and institutions across the country. So more to come in terms of listening sessions at various levels. And with that, we are at the end of my remarks, but do encourage you to move into Q&A now. I'd be happy to answer any questions. And we hope that you'll keep in touch with us through our new revamped website. Here's a generic email that you can reach us at. And we have also set up a LinkedIn page where we send timely updates to the field.